Welcome to the third part of our social welfare policy and introduction series. The first one dealt with the idea of income inequality in the United States and poverty. The second one focused on the topic of the demographic changes that led to the rise of the welfare state, kind of our American political development. And this third we'll focus in on the idea of Social Security and Medicare, mostly on Social Security, and really the rise of these two programs as being the two largest social safety net programs that we have in the United States, and also probably the two most popular social safety net programs that we have here as well. So let's get started and talk a little bit about our ideas or conceptions of the poor in the United States. And typically throughout American history, we've had a differentiation between types of poor people. So people that study the poverty have taken a look and studied that we basically have the differentiation between what we can consider the deserving poor and the undeserving poor. And the way that we would look at these two is that kind of the American work ethic, the American dream, the idea that you can work your way up in our American system. We tend to focus more on individuals' personal failings or lack of failings when we try to understand who should get government aid. So the deserving poor are those people in which, for whatever reason, that they really had no kind of responsibility for, they find themselves particularly temporarily down on their luck. So we tend to view older people, sick people, people that are caught unemployed during recessions when they cannot get jobs. So they're temporarily unemployed as opposed to long-term unemployed. And for those people, we tend to have programs. We support them because we feel as though this helps out people in the short term, or again, if they're sick or disabled or old. Those people are people that society deems worth helping. On the other hand, we have a second category of people that Americans have traditionally been relatively unwilling to help, and that's what we could consider to be the undeserving poor. And these are, for the most part, what we call the able-bodied unemployed. So these are people that essentially are physically capable of getting a job, but for whatever reason do not have jobs. So when we take a look at programs, particularly in social policy, we tend to find that programs for the deserving poor are much more popular with the American public than programs for what we would categorize as being the undeserving poor. And really, if you take a look at the American kind of social welfare state over the last 40 years or so, many of the programs that would have traditionally been talked about for undeserving poor have really been cut out in the United States. So let's take a look at programs that are most interesting as far as the deserving poor. These are what we could call entitlements. At least two of them are entitlements, and those are the ones we want to focus on, and that's Social Security and Medicare. So entitlements are essentially government programs that people have a right to access based on meeting certain criteria or certain conditions that the government sets down. And the most popular ones are what we consider to be social insurance programs. And these are programs that people pay into over the course of their lives. And then when they need those programs, they are able to get them from the government. So that can be Social Security, which we pay through our paychecks, Medicare, which we pay through our paychecks, things like unemployment insurance, which also comes from employers and is paid for. These are essentially government programs where we pay into the program, and when we need the benefits, we get them from government. And again, they're popular because they go to these people that we consider to be the deserving poor. Now, here's one of the problems with entitlement programs, and we'll get back to this a little bit later in the semester, because it's a great source of angst when it comes to looking forward to the budget. These are essentially programs that are pay as you go, and people pay into these programs, and consequently everybody that pays into the program is entitled to getting the resources. And that means that essentially government cannot control the costs of these programs because it doesn't have the ability to be able to say how long people are going to live, how many disabled people there might be, um, uh, when people are going to determine whether or not they want to retire or not. And as a consequence of that, this is a real strain on the budgets. And both of these programs are huge programs for the federal government, Social Security being the largest program that the government involves in. So where does the government get the money for these two big programs? Social Security, again, being this program that is set out to help older people uh, um, with some kind of guaranteed income when they retire, and Medicare, which is the program related to older people and their health care. It comes from what we would call payroll taxes. And unlike the rest of the tax system in the United States, at least at the federal level, which is progressive, meaning that we have different levels of taxation depending on the amount of money that you make, the payroll taxes are kind of a one-size-fits-all program where everybody pays the same amount. And in some respects, it's a regressive tax because of that. And I'll talk about that again in a second. So if you are a person who's employed by a business, let's just say Widener University, when I get my paycheck, I can take a look at that paycheck, and 6.2% of my pay gets taken out to pay for Social Security from each paycheck. And then the Medicare tax accounts for 1.45% of my pay. So if you're looking at that, you're looking at about 7.75% is taken out of your pay. Now, what you don't see happen there is that your employer, so in my case, Widener University, would also be matching that cost going for Social Security and Medicare. So in total, 12.4% of your paycheck goes to Social Security and 2.9% goes towards Medicare. Now, one of the problems is for people that are self-employed, because they don't work for somebody else, they have to pay the entire amount of the Social Security tax and the Medicare tax, which means they're on the hook for that 12.4% and 2.9%. Now, the interesting thing here, and this is where I mentioned one aspect of being a regressive tax, oftentimes we call taxes regressive taxes if everybody has to pay the exact same amount, because that amount hits poor people more than it would wealthier people. When we look at the Medicare and Social Security programs in the United States, for Medicare, all of your wages, 100% of what you make, are taxed. However, when it comes to Social Security, there is a threshold after which you don't have to pay those 6.2% taxes on your paycheck. So only the first $137,000 of your wages is taxed in the United States for Social Security. After that, you can make $200,000, you can make $10 million, you can make $1 billion. You're only going to pay that 6.2% tax on $137,000. And that changes every year. That's the cap for 2020. And what we find is that about 6% of workers reach their cap in any given year. So there are quite a few people that don't have to pay the tax over $130,000. So in looking at this, where does the Social Security money go? 85% of your Social Security payroll tax goes towards a trust fund that's focused specifically on Social Security, meaning that program that helps subsidize incomes for retirement funds for older people. That trust fund is divided between two separate things. One is people that are currently retired and their spouses, particularly if they're over the age of 62. And then there's a second program of people that have paid into the program and then become deceased. So if you pay into the program for about 10 years and say you die at age 50 and you leave behind 2 children and a spouse, those children until they reach the age of 18 will get some sort of Social Security payment. And I'll show you what that looks like in a couple of minutes. So that's kind of a survivor's plan as well. And then 15% of the Social Security payroll tax goes towards a trust fund for people with disabilities and their families as well. So essentially, these are two core groups. So those people that, again, are considered to be the deserving poor, those people who are older and have paid into the system all their lives, and those people who become disabled. So thinking about this for a minute, nobody's getting rich off of Social Security, and it was never really designed to be the sole source of income for people once they reach retirement age. So that's important to understand. Now, there are a couple of different retirement ages that you can have, 62, 65, and 67. The longer you can hold off and the longer that you don't need to take your Social Security benefits, the higher those benefits will be. And what we see is, in general, and don't have a slide here to back this up, but in general, what we see is that a lot of people that are blue-collar workers or work in a manual field tend to retire earlier given the wear and tear on their bodies from the jobs that they have worked in. And they tend to get the lower benefits, whereby oftentimes wealthier people or people that have worked in white-collar professional jobs oftentimes can work longer because of the fact that their labor does not entail manual labor, and they can work later on into their career, so they can wait until age 67. And in addition to that, oftentimes people that are wealthier are able to bridge the gap through their own savings to be able to wait to retire at age 67, whereby oftentimes working class and blue-collar job people do not have the ability to be able to live for a couple of years without any income. So generally, there's kind of this class differential on people and when they decide to take their Social Security benefits. So let's just take a quick look here at some of the averages for Social Security benefits, depending on different scenarios that you might find yourself in. So these are, again, they go up. What we call the cost of living adjustment, or the COLA, occurs every year. So these are the Social Security benefits as of December 31st, 2019. So if you are a retired worker, the average monthly Social Security benefit is $1,489. If you are a retired worker and you also have a spouse that is over 62, so essentially both of you are retired, you would get about $2,500 a month. Again, as we take a look at this and think about it in terms of, how much you might need to be able to survive, it's a minimal level, right? In essence, you're not going to get rich off this. It's about, something on the neighborhood of about $30,000, right? And about, $20,000 for an individual. If you are a child of somebody who's paid into the system and they died, so for example, the 50-some-year-old person that dies, you're a child survivor, you will get $900 a month through that survivor benefit program. If you happen to have a widowed parent and 2 children of a deceased worker, again in that survivor benefit program, you would receive $2,900 a month. Now, if the widowed parent happens to be a person that works, those benefits actually go down depending on how much that other person works, but they get the money for each child. People on disability essentially are given, on average, about $1,258 a month. So again, this is subsistence level, basic, more or less poverty level income. for people that are disabled. And in sum total, between all of the people that are eligible for Social Security, between those people that are retired, people who are getting survivor benefits, and also people that are disabled, in the United States today, there were 64 million people that receive some benefits from these Social Security programs. Now, one of the last things I want to point out here is that, the combination of giving health care to older people and also giving Social Security benefits has had a profound effect on poverty rates in the United States as we look at them. So, in general, all poverty has decreased in the United States since the 1950s and really since the 1930s. But you see this kind of precipitous drop among older people as well. So looking at, back in the 1970s, you're looking at 30% in 1970. By the time we get to 2018, only a little bit less than 10% of older people live in poverty, and mostly as a result of Social Security and Medicare. The final thing I'd like to point out here is that Social Security really influences people's lifestyles at the bottom of the economic pyramid much more than people at the top. And this is where it's made a profound difference in people's lives. So if we take a look at the right side, the right column that's here, Social Security accounts for 37% of the incomes of all Americans that are 65 and older. And I'm sorry I couldn't find a more updated chart from this. I actually spent quite a bit of time just updating from 2010. This is the most recent thing I could show you, but I'm very sure that things really haven't changed too much since 2002. When you look at this, if you look at the highest 20% of Americans, they have income from other sources and only rely on Social Security for about 16% of their income. They have other earnings, they have other assets, they have pensions, retirement accounts, and aren't really reliant on that. As you look more and more towards people that are poor and are age 65 and over, what we see is that, an overwhelming amount of that, that income that they have is from Social Security, to the point at, essentially the lowest 40% of people of income 65 and older, in the 80 percentiles of them, 80% of their income comes from Social Security. So that's one of the big reasons why we've seen a decline in elderly poverty in recent decades. And again, it's also one of the reasons why it's so difficult to be able to deal with the oncoming budget deficits in relationship to Social Security, is that because it is such a popular program, it's very difficult to curtail any of the benefits or even slow down things like cost of living adjustments, the same way with Medicare. We'll take a look at more of Social Security and Medicare later on in the semester, but this is just kind of an introduction to it at the present time to give you an idea of how the two biggest social programs in the United States work.